silent, yeah.
Alright.
So it says live now.
We are now live.
Okay, so I can just go to the control room.
Yep.
I guess it doesn't matter. It says this video is restricted, but I don't think that matters right there. Right? It says the video is restricted. As long as live chat works, that's what I'm here for.
Right.
And I can see you.
Hey, can anybody hear me out there? All right. All right, so we're live. So we're going to be starting our first live chat with lower back pain, what goes wrong, and what to do in just a couple of minutes here. It's 1:28. I told everybody we're going to start at 1:30, so that's what we'll do. So you can sit and get comfortable for a minute, and we'll get started. So for now, I would just say, hi, cook like a pro chef. Hi, Barbara. How's it going? You comfortable?
Yeah, just took my shoe off.
Okay, it's 1:30, so I think we should get started here. Welcome. Looks like we've got 9 people on the live chat so far. Hello, everybody. Irvin, you want to say hello?
Hey.
This is Irvin. He's our rehabilitation specialist here at Mobility for Life, and I just wanted to introduce him. All right, so I figure we should start it off with something fun. So I am always passionate about moving the body and control of the body and how we can improve that. So this is a fun little game. So here's what I want you to do, and you can do this right from your where you're watching. You're going to put your arms across like this, all right? And with one hand, I want you to hold up 5 fingers. With the other hand, you hold up 2 fingers, all right? And then what I want you to do is rapidly switch, and then switch, and then switch, and then switch. I want you to go back and forth and see, are you going to screw it up and kind of, accidentally do 3 fingers or 2 fingers? Irvin, why don't you give it a shot? He's got a unique finger situation, but let's see.
Okay,
all right,
so let's
cross
see.
your
So
hands.
I've got
5 open on one,
5 and 2.
and 2,
And then
switch.
switch.
Oh, I just screwed up. I went to a fist. Oops.
And then switch.
2,
Oh, that's kind of hard.
and then you do rapid fire like this. 5, 2, 5, 2, 5, 2, 5, 2, 5. Can you guys do that? What are they saying on the chat line? Nothing. Nobody's doing that at home. Okay, that's fine. Give it a shot. See what you can do. It's all about your control of your fingers and your coordination and how much it actually switches once you cross one hand across the other side of your body, and how much we really tend to screw it up. So it's kind of interesting stuff. Something to screw around with. parties with little kids and stuff like that, fun little games. But okay, so enough of farting around. I am Dr. Scott Hoar. We are streaming live from Boynton Beach, Florida. This is Mobility for Life, Chiropractic and Sports Medicine, and I really want to thank you guys for being here. And we're going to look at what we can do to help everybody that's dealing with some low back pain. I was really impressed with what the response when I put a poll out on the YouTube page, and it seemed like overwhelmingly people really wanted to learn about low back pain, what goes wrong, and what we can do to improve it. And since we deal with that every single day in our office very successfully, I thought, well, let's put something together for you guys. So thank you so much for being here. We're going to switch right over to our little presentation that we want to go over. Feel free to, number one, check in with the chat line. Say hello to us. Say where you're from. Hey there, Kakaroto, Gojito. I see that you're saying hello. Looks like Cooks Like a Pro Chef was having difficulty with the finger coordination test, so that's fun. People do tend to struggle with that. By the way, if we have any audio or visual or any issues that are bothering you, please feel free to let us know in the chat box. We'll do our best. From the Philippines, Kakaroto, very cool. Hello from Germany, SCXCX. Awesome, thank you. All right, let's go into it. So lower back pain, what goes wrong and what we can do about it. So first of all, I want you to think, I imagine most of the people on this chat today have or currently or have in the past struggled with low back pain. So if that's the case from you, what are you not doing in your life that you would be doing if you did not have the back pain? Some people would work out more. Some people would play with their grandkids more. Some people would play more golf. Some people would do more swimming. But we find ourselves having to give up activities in our lives because we're in back pain. So I want to hear from you guys. Put it in the chat box. What are you not doing that you would be doing if it wasn't for the back pain? I know in the past I've personally struggled with back pain. That's really what got me down the road to be a chiropractor, and it limited how much baseball I could play. It limited my skill and performance with baseball. So there's other things. I've stopped, at one point I stopped CrossFitting. I was doing a specific workout that I wasn't doing because of back pain. So I want to hear from you guys. How has the back pain affected your life, and what are you not doing? I want to hear who are you guys that are on this live chat right now? All my Team Hoar fans here that I'm calling them. I'm calling you guys. What's your profession? Are you chiropractors? Are you accountants? Are you students? Are you unemployed? Are you stay-at-home moms? I don't know. Stay-at-home dads. Let's hear from some of you guys and what you're doing. Too difficult to exercise. Small space. You have lockdown. Yeah, I understand that. Currently with the coronavirus, obviously all of us are pretty limited in our activities. But even in the absence of coronavirus, what sort of activities would we normally be doing that we couldn't? That's kind of what I'm looking to look at. Oh, a student athlete. Tashini Kanisha is a student athlete. Very good. What's your sport, Tashini? What are you normally playing? Mikey is a physical therapist or is studying physical therapy. Very good. All right. Quickly about me, Dr. Scott Hoar. That last name is Hoar, which is a pretty unique last name. I understand that. But I will say at my family reunions, when all of us Hoars get together, we've got some great jokes to tell each other, our little horror stories. Everywhere from my aunt, my uncle, my cousins, my grandmother. We're all a bunch of whores, so we've got some great fun stories to tell each other when we get together. But I'm a chiropractor. I've been in practice for 10 years, and we've treated just thousands of people that are dealing with back pain and low back pain, and we've had very successful outcomes. So I'm excited to sit with you guys and share with you today about what we can do to improve it. All right, because low back pain, as you see, it's the single largest cause of disability across the globe. That is just unbelievable. There's so many people that are dealing with low back pain. It's the number one injury, so it's a perfect topic for us to be addressing, especially as so many of us with COVID-19 are probably not as active as we normally are, and that's probably beating up on some of our backs. So this is a well-timed live chat. So what have you guys tried? The people out there that are with us today that are dealing with back pain, what do you normally do when you have the back pain? Do you take anti-inflammatories? Do you stretch? Have you gone to a doctor that's giving you cortisone shots? Have you tried physical therapy? Have you tried chiropractic? Some of us, I'm sure we've had surgery. We've done acupuncture. And there's some things that I don't even have listed here. So what are some of the things that we've tried to get out of back pain? I know when I was a teenager in high school and dealing with back pain for the first time, my mom had me sit in a bathtub with Epsom salt, these Epsom salt baths. And they didn't do anything. They didn't help at all. But it was this sort of advice a mother would give to a son. So what have you guys tried? I do have a little story with that I want to tell you guys. Low back pain. So let me tell you how I first got into chiropractic. I was, the Hoar family, as we were joking around earlier. I have so many family members, and I have a big extended family, that they all deal with back pain. It's the big joke in our family. If you're over the age of 40 and you're a Hoar, you don't stand up straight. And I remember being, 6, 7 years old and watching my family members give each other a hard time because they were all in back pain and they were all acting old and moving slow. And it just horrified me to know that, wow, this is my future. This is what I have to look forward to. And then fast forward, in high school, I was having back problems as a baseball player, and it just got worse and worse. And I played college baseball, and the back was getting even worse. So I think I'm age 18 at this point, and it's to the point where, I can't even sleep normally. I'm in so much pain. I would sleep. I remember in the dorms, I would lay on my back on the floor and elevate my feet to just relieve some of the back pain. And every day it was affecting my baseball performance, and it was really bothering me. So, I went to the orthopedic doctor. He said nothing's wrong. I went to the primary care doctor. He said, well, baseball's not your sport. So I left. I got out of his office as soon as I could. I went to a physical therapist who rubbed some ultrasound tools on me, and that didn't really help anything. I got a massage. That wasn't helping. So I was just all out of ideas. I was back into the Epsom salt bath and wondering, what the heck am I supposed to do here? And the athletic trainer at my school, which was Radford University in southwestern Virginia, he said, well, hey, we've got a chiropractor that comes and treats some of the athletes. Why don't you schedule an appointment with her? So I went, and she could feel during the examination how my lower back, how my hips, how my pelvis were not working correctly, and she fixed it. And I remember just leaving that office that day, just being flabbergasted and having, big wide eyes and like, what did I just experience? And I thought it was the coolest thing in the world. So the next day I went to the office at my university, and I changed my major so I could be on the route to being a chiropractor, because I just loved that experience where I walked in pain and really devastation from what I was dealing with. And this chiropractor lady, was able to put her hands on me and make me feel instantly better. And I walked out of that room feeling just worlds better. So I love that experience, and that's what I get to do every day. And so That's why we're here, and that's why I'm hoping to share with you guys as much information as possible to help improve you. Obviously, I can't put my hands and heal all of you, but and especially with the COVID-19, we want to see how can we be effective without actually being in proximity with each other. So again, I appreciate you guys being here, but the struggle of low back pain is not unique to you guys. I deal with it, and we all deal with it. The stable spine, the healthy spine is, believe it or not, we want a spine that doesn't move all that much. Now, hear me out when I say that. Your lower back, let's imagine my fists are vertebrae. When you move your body, it should stay relatively stable, segment by segment. If there's too much movement, it causes friction and irritation, and that really stresses sometimes the disc, sometimes the facet joint in the back, sometimes it's the ligaments, sometimes it irritates nerves, but it creates what I call a condition of instability. And instability is what opens the door to really causing pain and dysfunction, and that's what we want to avoid. So we want the stable spine. That is going to be a healthy spine. So how can we be flexible and free with our movement in our body without having instability? That's what we're going to be looking at. Poor core stability is a very, very common thing. And what's the question? We'll have it saved for future viewing. Oh, yeah. There'll be a recording of this. It'll be on our website. So poor core stability or instability is very, very common. Almost every patient I see has some degree of instability here. And what we end up having as a result of that is your body can feel the lack of stability and control in your spinal column. And so then certain muscle groups get recruited to be very, very tense and very, very tight. Those are your traps, your scalenes. You could see right here, there's all sorts of tension in this lady's neck. People's hamstrings get tight, people's hip flexors get tight, people's calves even get tight. So there's some very common areas that really get overstressed when your body experiences a lack of stability and control in your spinal column. And as a result of that, you feel too stiff and limited. So then what are we supposed to do about it? Well, most people, their automatic approach is, well, I should start stretching more. I should stretch my hamstrings more. How can I stretch my neck and shoulders more? How can I stretch my hip flexors? And while I agree it's a good thing to have flexibility and ease of movement in your body, stretching more often than not, in my experience, is not the answer. That does not tend to improve things. What really improves things is when you open up two specific areas of your body and you create an environment of stability and control in your spine and your core. When we have stability and control in our core, the two areas that can really move a whole lot better are, number one, our hips, specifically into hip extension, and we'll talk about what that means. And then number two, your upper torso, so your mid to upper back and your rib cage. These areas both get so stiff, and especially for all of you right now that are sitting down at your computers, and because of COVID-19, you've had to be sitting on couches for way more than you want to be or should be. It is not helping these two areas. You're continuing to get stiffer in your hips and your rib cage and your upper back. So, hip extension. Now, specifically, when the whole leg goes behind you, that's what we would call hip extension. And we need that movement of hip extension every single step we take. every time we stand up from a seated position, we are extending our hips, and it's so common and frequent for people to not have ideal hip extension. Remember, I told you that story of my family, in that we were all ragging on each other because nobody stands up straight after the age of 40. So we have that bent over posture where we're not really standing up erect and straight. Well, that's a result of not being able to extend your hips. All right. And if you can't extend through your hips, you're going to start moving with inappropriate movement and stress on your lower back and your pelvis. And so that is certainly not a good thing for people that want to have a healthy core, want to have a healthy spine. Upper torso rotation. All right, so we're talking about your rib cage, your thoracic spine, this whole area, and it gets so stiff and so limited when people have poor posture, when they sit too much, or are dealing with even, people that have shoulder injuries or neck injuries. They tend to, as a result of that, have very stiff and limited thoracic spine and rib cage. So we really want to open that area up. The better your flexibility and movement of your upper back and rib cages, the less stress and movement is going to come out of your lower back and your pelvis. And so that's a good thing. That's what we really want to focus on improving, especially from home. Now, there are a couple of no-nos I want to share with you guys. Like I was mentioning, the lower back, we do not want excessive flexibility. We don't want excessive movement. So there are a couple of things that is commonly practiced, especially in people with low back pain, that I really don't think are helpful. And that would be excessive flexibility and movement. You could see this lady, obviously she's a crazy flexible lady, and your average person is probably not going into positions and movements like this. But what she's certainly doing is she's flexing her lower back, she's tilting her pelvis with extreme movement to get into this posture and position. And that is not helpful. I see so many people that are hyper flexible that come into my office with this low back pain because they don't have that stability and control in the lower back that they really need. So I want you guys to consider eliminating excessive inappropriate movement in the lower back and the pelvis. So certain exercises to avoid. You'll love this. No more sit-ups. Get rid of the sit-ups. They are not helping. They actually help to tilt your pelvis and flex your lumbar spine, which puts way too much movement and too much stress on the discs. So say goodbye to sit-ups, because we don't really want those. Side sit-ups are the same sort of thing. I'm not a big fan of that. Lateral flexion into the lower back isn't great. Excessive kneeling hip extension. So that's what this is right here. Look at this lady. I want you to look at, if we wanted to have stability and control in your spine and your core, it would look straight. If you notice, this lady is certainly very, very arched. And she's probably feeling a fantastic stretch in her hip flexors here. But what is the area that's actually moving? It looks to me like the apex of the movement is her lower back right here. So she is arching the heck out of her lower back and losing stability and control of her lumbar spine, her lower back, and her pelvis. And she is getting a little bit of a stretch, which is fine, but I don't think long-term what she's doing here is very helpful. Squatting too deep, that is not good, okay? And I think I've got a little video here. Yeah, I'm going to pop up this video for 1 second. Pardon the appearance here, but I want to show you guys what I mean here. All right, that should be good. All right, so here's what I want you to do. I want you to look. This is me squatting a barbell. if you have a neutral, safe spine, it's relatively straight looking. Now, the reality is, you have a curve here called a kyphotic curve, and then a curve here called a lordotic curve. But we're gonna just look at this overall as relatively straight. So if you're straight, you're neutral, and that's when you're protected. What I want you to look at here is, oh, that didn't work. Let's do it differently. I think I can go, let's go slow-mo. Yeah. All right. As I descend into the squat up to this point, you look, it's very neutral, right? I'm still safe in my movement pattern. I'm not putting additional or unnecessary or inappropriate stress on my spine. So that's cool. Let's go forward a little bit. Still, I think I'm pretty neutral. I like it. And then boom, I've actually lost neutrality. And I'll show you what I mean by that. We'll go back through this. So I want you to look at my lower back right here. Because right now in this position, it's nice and neutral and it's protected. But what's going to happen as my hips sink down deeper for this squat, you'll actually see it kind of tuck under. All right, we call that a posterior pelvic tilt. And since I'm weighted right now, I'm bearing load with this barbell. That's right, SCX called it the butt wink, and that's exactly what this move is. You'll notice as I descend again, the lower back tucks right, boom, there. And I've lost all neutrality in my spine. And that is going to open the door to me hurting myself. And that's one of the reasons, I was a catcher in baseball. And we always want to squat as deep as you possibly can when you're playing the sport of baseball. And I was butt linking like this for years and years. And that's one of the things that opened the door to me having the back problems that I had in the past. Okay? So that's an example of our injurious movement. All right? So, any questions about that? No? That's good. All right, perfect. Now, here's what you guys are dealing with. Obviously, not that many of us. Oh, look, Dr. Megan Jack. Does the amount of weight you squat affect this? Sometimes it does, sometimes it doesn't. Thank you, Dr. Jack, for doing a super chat. We appreciate the money and your question. The amount of weight typically does not impact the butt wink. There are certain scenarios where, believe it or not, if people add more weight to the barbell, that creates an environment of stability and control in your body because you're turning on so many of your muscles. And once you turn on so many of your muscles, sometimes you are able to keep that stability and that neutrality in your spine a little bit more than if you're unweighted. But for the most part, people that butt wink are people that butt wink. So like a guy like me, my response to butt winking, believe it or not, now I butt wink like you saw because of the anatomy of my hips. All right, I have a certain amount of God-given flexibility in my hips, and so if I go into a squat, doesn't matter how much stretching or how many chiropractic appointments I go to or whatever, I only have so much hip flexion. So if I try to sink deeper into a squat, instead of getting the motion from the hips, like would be ideal, I get it from flexing my lumbar spine and tilting my pelvis. And that's one of the things that cause me pain. So what I need to do when I squat, and I still think squatting and squatting with weight is a very healthy thing to be doing overall, is I actually just cut off the depth of my squat. I don't squat what they call below parallel, aka when my hips, actually here, why don't I just go back over here. When I squat, I keep my hips even with my knees. I don't let my hips sink down below my knees, because that's when I'm going to lose neutrality and I'm going to start to, as we say, butt wink and cause all sorts of discomfort. As far as what we're dealing with now, because most of us aren't squatting with weights in gyms, unfortunately, we're sitting and we're reclined, and that can lead to low back pain just as much, if not more, than when we're lifting weights and doing more extreme sorts of movements. So how many of you right now are sitting in this position as we speak? I bet it's too many of you. And then I bet a bunch of you just kind of fixed your posture and kind of sat upright. So good for you. I'm glad you fixed your posture. But you can see in this position, he's maintaining his nice kyphosis of his back, which is great. But then his lordotic curve, aka where in his lower back, is doing kind of a reverse curvature right now. And that is not a good thing. That's not a healthy thing. You're adding excessive, inappropriate movement to the lower back, and that adds stress to the area that interrupts the conditions of stability and control. And then as a result, what happens is our hamstrings start getting stiffer. They start getting tighter. Our hip flexors right here, they start getting stiffer. They start getting tighter. And we have those conditions that we talked about where, because of the lack of stability and control in your core and your lumbar spine, certain muscles like your hip flexors and your hamstrings start becoming very, very tight and limiting. And then you feel like, oh, the answer is to stretch more, which is not always what's really going to help in the long run. Low back injuries. What have you guys had? What are you dealing with? With me, I certainly had herniated discs in my lower back. I had radiculopathy right here. And then I had spondylosis, which is degeneration and arthritis of my lumbar spine. What are some of the things that you guys deal with? I'm sure plenty of the people on this live chat right now have actually gone to a doctor and gotten a specific diagnosis. So share with us in the live chat box, what are some of the diagnoses that you have received in the past? Low back yeses. All right, and we're sitting here, we're just about at 2 o'clock. So what I'm going to do, just so you guys can plan ahead, we'll keep going till 2:15 today, and then we'll open it up for some questions and answers. But I want to make sure, be responsible with our time and make sure you guys aren't on here for too long here today. We do also have patients we're going to treat this afternoon, so we got to be ready for that. I told you about the no-nos with the low back. Those are the movements we want to avoid, which, like I said, was excessive flexion, excessive tilting, sit-ups. I said no. But what are the yeses? Well, we want to stabilize our back. We want to quiet down and limit the movement. We want movements and strategies that create anti-rotational activation. I'll let you know what I mean by that. Anti-lateral activation. And then I really love doing unilateral exercises. So we'll show you what I mean by that. Here's this anti-spine movement training. All right. Now, this is the one most people have heard of in the past. This is called a side plank. Now, everybody loves the front plank. That is the one that gets all the press, and it's a very popular exercise. But I really don't recommend the front plank all that much because people tend to hold it for too long, and then their belly tends to sag, and they have pelvic tilting that goes on, so they lose that stability, that neutrality in their spine and their lower back, which, like I said, I don't think that's healthy. What she's doing right here with this movement is called the side plank, where if any of you have done this, and you know, for those of you that have done this or not done that, why don't you do it right now? Leave your computer, jump down on the floor, and let's see a side plank. And what you're going to feel is gravity is really pushing your center of gravity down towards the floor. And what you have to do is you have to create stability and control with the lateral stabilizers of your, not only your spine, but your pelvis, your hips. This actually stabilizes your knee and your heel. This stabilizes the shoulder girdle. There are so many great things that come out of an exercise like a side plank because you're creating that stability and that control from a lateral perspective, aka sideways perspective. And this is something that most people are really not training in the gym enough. And so anyways, this is a great way, exercises like this, to start stabilizing and quieting down the lower back movement. Here's an exercise right here. Now he's using a kettlebell, and he could be doing a number of things. I don't actually know what exercise he's performing right now. He might be doing an overhead carry, which is when you hold a weight over your head and you just walk for a certain distance. He also might be doing what's known as a snatch movement, where you fling that thing up. Hey, Michael Sardano, you like my voice, huh? Thanks so much for jumping on here. There's a familiar name. Appreciate you being here today. Anyways, back to this exercise. So this guy right now, he's holding a weight in one arm, okay, versus holding it in two arms. So what's going to happen here is gravity is going to force this weight straight down. So for him to maintain posture in this positioning, he has to have all sorts of stabilizers engaging in this direction. So he's going to be using his side obliques. He's going to be using his shoulder girdle. He's going to be using hip stabilizers, all sorts of anti-lateral activation and stabilization, because it's a unilateral exercise. And there are so many great ways that you can do these unilateral exercises that are helpful for your spine in the long run, whether it's doing squats with a weight in one side, or just holding a weight. I mean, you could do this with the groceries. Instead of balancing your groceries in both hands, if you just held it in one side, you'll notice the opposite side of which you're holding the groceries. If you feel your obliques and the side of your core, you'll feel all sorts of activation going on, which is going to be helpful for your spine and your core in the long run. So anti-spine movement training, I invite you to start considering things like that. And of course, there's lower back nutrition, because we could do all the right stuff in the world, have perfect posture, we could have the perfect exercises, we could all get chiropractic care, and then if we go home and eat a bunch of crap, that will undermine the chemicals of our body, which will lead to our bodies producing way too much inflammation and irritation, and that will just beat up on our body, and that will not be a good thing. So I invite you guys to be taking fish oil supplements, getting your vitamin D. Right now, if you're allowed to go outside, I would take walks in the sunlight and get a little bit of your vitamin D. More fruits, more vegetables, less fried food. We want to be doing grass-fed meats and eggs and all sorts of stuff like that. So now you know. Okay, these are one of the steps we like to do after, when people come in for treatment in our office. We kind of have a two-pronged approach. At first, we do the chiropractic treatment, which is great because it takes the imbalances of your body and it kind of presses a reset button with the manipulation or with the soft tissue treatment, whatever it is we choose to do with you. So you have this little window for about 30 to 60 minutes where your body is a lot more balanced than it was otherwise. So during that window, we do a progressive rehabilitation. And a lot of that is these anti-rotational, anti-lateral movement exercises where we can create core stability in your core and in your spine. And that leads to a healthier environment for your body going forward. And that's what we do. So what I wanted to do now that I've completed my little spiel here on lower back stuff is open it up for questions and answers. I know a number of you have had questions throughout my little presentation, and I haven't been able to answer all of them. What questions do you guys have for me, so that maybe I can provide some insight into what we do to help people? Irvin, were there any questions that went by that you weren't able to answer for us?
Let's see. I believe I've answered most. JZMA had a question about how do we suggest sitting in a chair, which I just responded to.
Okay.
Let's see.
Yeah, sitting in a chair, we always like it when you scoot your butt back as far as you can in the chair. And that way your spine actually maintains contact with the back. And that helps to maintain a little bit more of a neutral posture. When we allow our butt to shift forward in our seat, that's when we get kind of that curved lumbar spine and pelvis, that pelvic tilt that is not helpful because it's adding too much movement and we're losing our stability and our control. So certainly slide as far back as you can in your seat. Of course, that only works if the seat isn't too large. If it's too large, well, there's just no way to win. So make sure you have a properly fit chair. What else, Irvin?
Mage Prometheus said that he has a cushion that he holds for his lower back. Is that something you would suggest continuing?
Yeah, that's not a bad idea. Thank you, Mage Prometheus. Mage? Mage. We talked earlier about the curves of the spine. You know, your upper back is supposed to be curved just a little bit, and then your lower back is curved just a little bit. And there are lordotic curvature pads that you can put on the lower part of your seat that are very helpful in creating that neutrality, that condition of stability and control in your spine. But again, it only works if you scoot your butt all the way back in the chair so that you're not moving your lower back more than you should. Hi, doctor. Is there a way to adjust myself? And that's from Sudden Death Rune. That's pretty interesting. Sudden Death is your screen name, and you're asking that question. I don't really recommend adjusting yourself. We went to school for a long time to learn how to adjust, and it's a very specific thing. Now, I will tell you, I guess you could say I adjust myself all the time. I know when I get up first thing in the morning, I feel this stiffness just like anybody. I feel it in my knees, I feel it in my elbows, my neck, my shoulders, my low back, my toes especially. And what I notice is just in my morning walk to the restroom, my toes are I'm getting all sorts of pops and cracks. But then as I start to restore normal movement in my toes and my foot and my knees and my shoulders, some of those areas do pop and crack. And those are fine. I don't know that I would really recommend doing a lot of self-adjusting, because I think it creates that condition of hypermobility, aka excessive inappropriate motion. So even if somebody, we get it all the time, people come in and they crack their necks and, they're doing one of these sorts of things, and what you'll notice is the more you do that, the more you have to do that. Okay, because maybe it does feel good to self-adjust, but what you see all the time is, there's certain areas of your neck that should move a lot. There's certain areas of your neck that shouldn't move much. What I mean by that, your upper neck, we want to be very, very flexible. So a lot of times, those are the areas I adjust. But most people I see that are just kind of cracking their neck by themselves, they're cracking their lower neck. All right, so they're getting excessive, inappropriate motion to an area like your lower neck that really should not move all that much. So I recommend trying to limit yourself adjusting. And it's one of those things. People love cracking themselves. So it's going to be difficult for me to say, hey, stop doing that completely. When they do it probably 25, 30 times a day. But I would recommend trying, hey, why don't we go for 5 times a day? Why don't we go for 3 or 4, maybe just once a day? That'd be a great way of kind of weaning down all that self-adjusting that you see. Maybe you should do a crack video of you adjusting yourself, especially your toes. Well, we'll have to take a video first thing in the morning then to see me cracking my toes and stuff. Lower back, Michael Sardano, my lower back has been hurting in the morning. Is my bed too soft? I'm a side sleeper, I'll admit. There's nothing wrong with sleeping on your side. You can sleep on your side and keep your spine completely neutral and completely protected. So there's nothing wrong with sleeping on your side. But yeah, sometimes if somebody's bed is too soft, you can just kind of picture it in your head. If your bed is too soft, you're going to sag down. And if your spine starts sagging down, that's another thing that's going to interrupt the stability and control that we want in your spine, and it's going to create that environment of excessive movement and not a good thing. Any advice? Mancy Man says, any advice for lumbar disc bulge herniation exercises for sciatic pain? Yeah, certainly, the things we did today, where we looked at something like a side plank, something like a carry, where you hold a weight on one arm and you walk around. Those are both exercises that might provide the stability and control that your spine is missing with your disc bulge that's causing sciatic pain. But I will say it's very difficult to recommend specific exercises over a live chat like this that will be the right exercise. Because what we do in our office, we really specialize in evaluating people's movement and finding out what are the exercises that you really need to stabilize your spine. Because if I'm dealing with sciatica, exercise A might be the one that really stabilizes it. If Irvin over here is dealing with sciatica, it might be exercise B. There he is. That he needs to stabilize his spine and get it to feel better. And for you, it might be exercise C. So basically, unfortunately, if we're talking over here through the computer, it's got to be a guess and check. You need to check different exercises. I do have a playlist on my YouTube channel that's specifically for low back and hip health. And there's one particular exercise called the active straight leg raise, which is a great one to try when you're dealing with sciatic like symptoms when it's shooting down your leg. So I would give that a shot. Hamburg City. What did Hamburg City Brick say? When you did a wrong move and get lower back pain, what's the best to do? Moving like you normally do and feel pain, or lie in bed? That's a great question, Hamburg City. Thank you for asking that. We want to restore normal movement as quickly as possible. All right. Now, obviously, that is easier said than done. I don't recommend bed rest. I'm not big on bed rest. If you're dealing with back pain, studies have shown that the sooner people get out and about, the sooner people get back to work, the sooner people start to resume normal physical activities, the less likely they are to develop chronic pain in their spine. So what we do with our patients that we see in person is we find the specific exercises that create the stability and control in the core and the spine that are not painful. Okay? Because obviously, if any particular activity, if any particular movement, any particular exercise hurts, well, it's not the right one for you to be doing. Okay? Some people believe that there's this no pain, no gain sort of philosophy, and I am not a believer in that. What we want to do is create stability and control with specific exercises that do not cause pain, do not cause irritation, but they increase all those stabilizing forces on your spine so that the areas aren't bothering you as much. So Hamburg City, I hope that answers your question. I would start finding different stretches, different exercises, different stability movements that start to make your spine feel better without pain. All right, Michael Sardano's got to run. Thank you for being on the call. Hamburg City, you are welcome. JZMA says sleeping on the floor be damaging on your back. Yeah, well, it can be, certainly, because like we said, the spine has those curves, right? Those I should have had my the spine right here so I could point to it. You want to have curves in your spine. So if you lay flat on the ground, that is a straight surface, and that will lead to decreasing the curvature in your spine, which really is a degenerative or aka arthritic producing situation. So we want to restore, we want to maintain those curves because that's what keeps us healthy, that's what keeps us strong. Mike Sardano says he misses your face. Oh, did you see that? All right, any other questions? So I'm referring to you guys as Team Hoar. I really appreciate you being on this call, on this live chat here. This was our first go at a live chat, and our next one is certainly going to be better, but I really love the response from you guys. We've got 26 people on the call, on the live chat right now, so thank you so much. I hope I was helpful. Don't forget to subscribe to our page so that you can see our next video. I will tell you, our video that's going to be released next Tuesday, it's with Brent Nichols. Brent was a Army soldier, and he was forced into early retirement because of neck, back, and knee issues. So we had a lot of fun treating Brent and starting to stabilize his neck because he was actually forced into early retirement because of his neck pain. So love making a difference for somebody like Brent, who serves our country so well. So look forward to that video next Tuesday. Thank you so much, and we'll see you next week.